Hello, my name is Stephen Wellman, Vice President of Content Strategy at HIMSS. I'm joined today by Atif Chogtai, Senior Director, Healthcare Market Leader at Red Hat. During our interview today, we will be discussing how Red Hat's open source solutions, intelligent data as a service in particular, can help health organizations meet CMS interoperability and patient access mandates. Atif, thank you so much for joining us today on HIMSS TV.
Thank you for having me. Pleasure to be here.
The CMS interoperability and patient access final rule is driving payers and providers towards a deadline for interoperability using FHIR. However, this is just one piece of a much larger picture. Atif, what are you hearing from healthcare organizations in terms of how this rule and the encroaching deadline is driving their healthcare strategy forward?
Hey, thanks for the question. So just from a context perspective, we had this meaningful use to requirement out there, which was all around driving data interoperability. And this is kind of redo of that. And organizations that we are specifically working with are looking at this rule as a data transformation. If you look at the value chain, there's a lot of different organizations that are involved in driving outcome for the patient or better outcome for the patient. This data interoperability is ensuring that we are having the right information available to the right care provider to make the best decision they can in the context they are in. Not just sharing of this data, they are actually looking at, the organization are looking at, okay, if we are going to share this information, how about we share additional information based on some of the expert systems that we might have to drive better insight out of this data and provide like recommendations related to a patient diagnosis. So they're really taking this as an opportunity to transform their business model on how they are operating in the ecosystem of care providers. Payers, essentially, who are managing to per member per month, they are also looking at, hey, if we are providing this data, what additional information that essentially derived information and knowledge that we could provide in a similar format following these to essentially enable better outcome and better engagement with the member for them. From a hospital perspective or provider perspective, most of the organizations that are depending on one of the major vendors out there like Epic or Cerner, they're looking for them to provide this capability. But when you look at larger healthcare systems that might have different EHR in their environment, now they have to pull that longitudinal record or that member experience with their facilities into something that is available through this FHIR Access API. And while they're doing this, they're also looking at, hey, is there a way for us to have a more meaningful, besides providing this data, but more meaningful dialogue with the care community in terms of the drive knowledge that we can attain from the data that we have. So they're also now embarking on this, data transformation journey, like part of digital transformation. One aspect is data, one is the performance, one is the actual processes, business processes that they need to reinvent. So this mandate is essentially has kickstarted that data transformation that industry has been so lagging behind.
What role does Red Hat play in enabling these data transformation strategies? How are you helping these organizations?
We work purely, Red Hat, is an open source company. We work purely in upstream community with open source technologies like FHIR, HL7, and bring those technologies in a way that is consumable by enterprise. So open source moves at a very rapid pace, and that's the purpose of that. However, organizations, they don't need to be in a bleeding edge communities. They want basically, from a risk perspective, a support model. They want essentially a capability to have a product roadmap or capability roadmap and plan accordingly. They also want security and other credentials that with PHI and PII make it very risk tolerant for them. Having said that, we specifically partner with these customers around bringing those open source innovations to have it consumable by these enterprises. We use basically some of the industry transformation best practices with the partner ecosystem to look at their data strategies, to look at their performance strategy, also look at their revenue leakages, potential revenue leakages, and put together a plan on how not only they can meet this regulation, but also how they can improve their overall performance from either from value-based contracting perspective or driving, for payers per member per month cost down. Lastly, we have built, just for meeting the mandate, a open source community that is out there and available off of redhat.com/health website, which has already pre-built these accelerators, we call it, to meeting this interoperability mandate. And that's available for free to the industry from our perspective, to try to drive this innovation and disruption faster.
Can you talk a little bit more about the value of open source and open communities? It's not a concept maybe that's as prevalent in healthcare as it is in maybe some other enterprise verticals. What is the value of open source specifically to healthcare?
Open source, if you look at the healthcare, right, and I talk about this model, if you look at healthcare and imagine there's a member or patient in the middle, and you have a bunch of different organization entities or actors that engage with that member or patient to try to drive better outcome, or try to drive wellness for that. And they all shared a common goal and shared vision. If you remove the patient or member from that picture and put open source and put all the other organizations, keep it the same, that's what really open source is. We essentially rally around a vision, a shared values to drive an outcome that we want for that capability. And healthcare culturally and open source culturally, they are identical. So from an adoption perspective, it's the same thing from a cultural fit perspective. Specific to open source now in healthcare, we have so many open source projects that have transformed healthcare, like HL7, Happy, and these others. They're all open source community that are really passionate about democratization of the data in healthcare and making that data sharing possible and standardizing on that. So open source in healthcare is really being used to break down the vendor lock-ins, the data silos, and try to accelerate the digitization or disruption in the industry so that our cost for healthcare, which is staggering compared to any first world country, goes down.
Drilling back into something we just discussed a minute or two ago, and that is around that change in the CMS interoperability and patient access rule. That deadline, as we said earlier, was recently extended from January to July 2021. What timelines should healthcare organizations consider for implementing some of this open source technology like IDaaS for addressing that new deadline change?
Yeah, so IDaaS is basically our accelerator that I mentioned previously. Okay. It stands for Intelligent Data as a Service that we open source is made available, uses some of the best industry open source communities out there to help customers meet this mandate, like the Blue Button requirement and other FHIR mandates. And the work that is needed there is to connect it with your data sources, and it will do the rest, right? In order to when to start, there's two spectrums to this, right? Two sides to this spectrum. One is an organization that is standardized on a single EHR vendor. They are really partnering with their vendor, EHR vendor, to have them provide this capability, and it totally makes sense because their whole organization enterprise runs on that. Now, on the other side of the spectrum, where with M&A acquisitions and expansion, there are different vendors that are in the environment, and that patient data might be in different systems which do not really communicate with each other. That's where you have to use something like the IDaaS to now pull that data together, correlate it, and then make it FHIR conformant and expose it to a secure endpoint. For that, it depends on, do you have a good grasp of all the pieces and where the data is residing? Or do you know what your security model is and how that data can be accessed? So for that, I would say start now and plan, because it could be a significant amount of work if we don't have that foundational knowledge, which most organizations might not. And that's what we're finding out. We do have an overarching knowledge, but the details are lacking, and it requires a lot of discovery by the customer to identify what the right strategy for them would be.
And just a follow up to that, we're probably have some providers here in the audience watching, and they're asking themselves, what questions should I be asking either in the discovery phase, there's still some folks there, or at the midpoint, and maybe they're re-examining their timelines due to this extension or just really due to all of the things they're managing through the pandemic. What questions do those providers need to be asking themselves right now?
One of the things most likely that is happening, and I've seen this, there's a laser focus. We have a project, right, defined that we need to meet this mandate. And there's a laser focus on how do we drive the compliance for this mandate, and how do we lay down all the capabilities to make it happen. I feel like oftentimes that folks that are going down this path, they miss the bigger picture. Because as I started in the beginning of this conversation, this is an opportunity to do a data transformation in your organization, to really be KPI or outcome-driven organization, which is what has been a trend from a value-based contracting perspective. So when you're designing your approach and looking at how you're going to bring the data, make it such, first of all, that it can be any data set. And it has the capability, and you have the capability to add additional views of that data that drive knowledge without having to redo the whole architecture or redo the data models that you are building. So it should be very flexible. And that's where we, push for this concept of treating data as an asset and really making it available as a service. So at the time when you realize, hey, I need a different viewpoint for my chronic kidney disease patients and the population that I'm serving, that is exposed without having to disrupt any other architectural segments that you have laid down or reconfiguring them. It should simply be a new endpoint that is exposed, and that is further exposed to a security endpoint like API gateways to expose it to the outside world, and not having to redo any of that architecture. And that's where microservices, containers, and cloud comes into that picture.
Great, thank you. Thank you for all of that. I know that those are big top of mind concerns for our viewers, particularly as this deadline approaches. One kind of next question for you, and that is, what other concerns should our audience members be thinking about? We've talked a lot about the questions they need to be asking. We've talked a lot about the value of open source and open communities. We've talked about this need for digital data transformation to meet these new rule changes. What else should they be thinking about when it comes to their data strategies and interoperability? Or let me put it another way, what's next after this rule change that they need to be thinking about today?
Well, I really think that this is the foundation to be able to use AI ML technology to drive insight of this data and making that data actionable. So I really think that the next step for this is for industry and payers and providers to start exposing, based on those data sets, machine learning models that are effective in doing diagnosing or better prediction. And that's goes towards, disrupting the ecosystem. So I'll give you an example. One of our customers are really good at detecting COVID from X-rays, and they did it through ML AI and image processing. If you feed them X-rays, it can predict up to 90% accuracy if the person has a COVID or not. Now that's a capability with the right data set could be used across the whole country, right? So this interoperability mandate will help, first of all, free up that data. Then that algorithm is now going to be exposed through, say, marketplace for healthcare, or through, Red Hat also has a marketplace where other vendors, customers can promote their capabilities. Now, imagine you are a facility somewhere in the remote area, don't necessarily have the expertise, or you are just a facility with large healthcare system with you want to tap into as a second opinion for this capability, for this diagnosis. You can easily, through your EHR, hopefully, or another way, call this ML algorithm to give you a second opinion. Does this person have COVID or not? And then that might change how you behave. Similarly, you can think of treatments for chronic kidney diseases, other areas that ML and AI algorithms can play a big role. And the beauty of this is the more the service gets used, the smarter it gets. So the bigger the adoption is, the biases and all those things, are taken out of it.
Great, thank you for sharing that with us. And then finally, you mentioned a web address there a couple of times. Where can someone go to learn more?
Easy, it's redhat.com/health. That's our front page to Red Hat Healthcare, and there's a lot of material there. But at any time, feel free to reach out to us through the contact page on the /health side, and we'll be happy to get back to you.
Big thanks to our guest today, Atif Chagtai, Senior Director, Healthcare Market Leader at Red Hat. And thank you, everyone, for watching.